I'm Anna Webb. Welcome to A Dog's Life. Hey, Mr. Binks, you know that Dog Dental Month is fast approaching. Well, that's why we're about to jump on Zoom to speak to Dr. Nick Thompson, who is going to talk about how he thinks we can keep dogs' teeth in the best nick. Nick Thompson, welcome back to A Dog's Life.
Hello, Anna. How are you?
Yes, really well. Thank you, Nick. Yes, it's been a busy start to the year. How about you?
Yes, it's been absolutely non-stop. Everybody seems to be catching up for the last 3 years this year. So lots going on, lots of summits, lots of expos, lots of conferences, presentations. So a lot of education going on. So very, very exciting.
Yes, no, it is good because I really think the way forward is education at the moment. One of the things that I notice being out and about, with dogs and their owners and helping them is that there's a remarkable lack of understanding of what a dog actually is. And of course, a lot of confused information as to what a dog should eat, how you should train a dog, but also about things like environmental stressors.
Yeah. Yeah, I mean, it's very interesting. People come to see me for me to give something to their dog to make them better, whether it's homeopathics or herbs or supplements or nutraceuticals, whatever it might be. But in a great number of cases, it's not what I add to the situation; it's what I remove from the dog's life, such as removing any excess vaccination. I always like to remove any worming product that they don't need. I love using herbal products instead. And I do worm counts as well, Anna, which is where you send off a poo sample from the dog and you see whether the dog has worms that need to be treated at all. And this is very, very simple. Also, we are reliably informed by the pharmaceutical companies that we should be giving pesticides. We're putting pesticides in or on our dogs on a continual basis, and I can't think, but that must be unhealthy to have these potent pesticides put on as a drop on, or in as either a monthly or a 3-monthly tablet, because my logic is, if you haven't got fleas or ticks, why would you use a product? So why would you use one of the pharmaceutical products? So my job is not only to add new elements to the dog's life, but also remove those elements that might be holding the dog back, might be making them ill in the first place.
Yes. Well, I'm on your page, Nick. I believe in the mantra, test before you treat. But that also, of course, with worms particularly, I must say I do the worm count thing too, Nick, and it is so easy. It is so easy. And I recommended it to someone on Saturday, actually. But it's with vaccines, isn't it, as well? Because we don't have to annually booster our dogs.
Well, depending on who you talk to,
yes.
There's leptospirosis. The license is for an annual vaccination, but it's interesting that when they tested the L2 in about 2005, I think it was, and then they tested L4 in about 2012, 2014, and they only tested the vaccine for 12 or 13 months. So it might be that the leptospirosis vaccine, this is the annual one, the rat urine disease, leptospirosis, this is the vaccine for that. Maybe it lasts 18 months, 2 years. They haven't tested. I'm just trying to think of an analogy. If you only test something for a short time, then that's you have no knowledge of the duration of that thing any longer. what's it? Well, I'm trying to think of a good analogy, Anna. I don't
Well,
know if you.
I know what you mean, but with
Yeah,
the vaccine,
yeah,
it's an interesting one, isn't it? Because it's one of two of the passive vaccines, isn't it? Rabies being the other passive rather than active vaccine,
it's a
which
killed. Yes,
yeah, which has a different effect and works differently because it's a killed vaccine rather
yes,
than an alive vaccine on the
yes.
body. I must say, I will say this. I've actually never given my dogs a leptospirosis vaccine, because the risk to the benefit for me, I live in there's lots of rats in London, obviously, probably more than there is in the countryside. But
Mm.
you have to ask yourself, why are there so many rats if leptospirosis can actually kill rats?
Yeah, I guess the thing is that if you are a rat and you get leptospirosis, I don't know anything about the natural history of leptospirosis in rats, but they can last a good time, long enough to distribute the bug in the environment um, before they die. So um, I'm with you though. I don't vaccinate my two. I've got Bluebell and Mouse there, Whippet Italian Greyhound crosses, and I'm not vaccinating them for leptospirosis. I agree with you that when you look at all the literature, I think that the risk of getting leptospirosis is outweighed by the potential risk, in my mind, from the vaccination. So I've chosen not to vaccinate my dogs. They did get a parvo when they were young. They got a single parvo when they were about 20 weeks. So I'm not anti-vax, but I'm just very keen to bring a rational thought process to the vaccination debate.
That's interesting that you used a single shot of parvo because yeah, I didn't think you were able to actually get single shot vaccines anymore, because it's all about the combo jab.
Yeah, you can get parvo as a single shot, and I get mine from a regular veterinary wholesaler. You can't get distemper on its own. You can't get adenovirus 2, hepatitis. You can't get that on its own unless you go to the States. But you can get parvo. It's called Parvo C, is the one that we use, and I use it very infrequently. But if people have heard my approach to early vaccination, they've sometimes email me, and we can arrange for a single vaccination. I will only do that if I've had a good chat with them so that they know the pros and the cons of full vaccination and the pros and the cons of a minimal vaccination. I think it's informed consent is very, very important in this discussion.
Yeah, informed consent, because I think, oh, that doesn't exist a lot. But I think sometimes, particularly in the veterinary profession, it's been my experience over the years. I think it has got better. I took Mr. Binks up for some bloods to be taken only this morning, actually. And the
Mm.
vet, I've got to say, really good. Can't fault him, really keen. He's not been jaded yet. I put him at probably 35, enough experience to know, and had worked in a lot of it. Anyway, I'm not picking him up for anything, but it was actually a pleasurable experience today. Whereas, he doesn't mind I feed raw. And I even said to him, I treat with homeopathy, and it, was okay. Whereas I'd be banned from a practice for talking about homeopathy in the waiting room.
Gosh, I'm sorry to hear that, Anna.
No, it's true though.
I
Can you
think
believe
that
it? In
yeah,
Buckinghamshire.
the best medicine is a broad approach to medicine, embracing the best of rational use of pharmaceutical rational use of vaccines, if you choose to go down that line, and the rational use of herbs and homeopathics and nutrition. That's, I think, really, really is the future. It's going to be the very best of all worlds. Some people call it integrated medicine, and I think that's an exciting prospect. And it's happening now. I run my practice, and there are many people who are running similar practices up and down the country. Not enough, but many practices. But I think what is happening is that conventional vets are learning that they don't have all the answers, and that if you know bring somebody with broader knowledge of these things, homeopathics, herbs, and what have you, then you're actually enhancing the practice. You're enhancing the scope of the practice. The more tools you have in your toolbox, the more cases that you will be able to successfully get through and back out the door into real life. That's what it's all about. That's what all vets want: happy, healthy patients going back out the door. That's what it's all about. And I think that holistic approaches are really part of that.
Yeah, I love the way you say tools in the toolbox there, because when I went on my baptism of fire following Molly's diagnosis of suspected bladder cancer, and I did my study, you know, the College of Integrated Veterinary Therapies, which just opened my eyes, you know, like so opened my eyes. It's having so much choice at your fingertips, whereas a rigid conventional practice for me only has painkillers, antibiotics, surgery, and steroids. So there's so much more choice. And where one herb may work for one dog, with different herbs that can be combined, you know, the scope is so delicious.
Yeah, it's like I say, it's very exciting. And I think it stands to reason that if you bring new therapeutics, herbs, homeopathics, and all that stuff, but also when you branch out into these things, looking at nutrition and herbal medicine theory and what have you, you actually bring a new philosophy to bear. And I think that medicine, there's a lot of philosophy in medicine. You know, we are dealing with life and death very often, and I think that to be able to look at health and disease through a new philosophical paradigm is very, very helpful. A non-mechanistic, you know, okay, dog's got this bacterium, I'll give it this antibiotic, and off we go. It's looking at other paradigms and saying, okay, there seems to be an overgrowth of this bacterium. Why is that there? Is it because of the diet? Is it because of the stress? Is it because of problems in the house? I was wanting to talk to you, Anna, for example, about how many chemicals dogs and humans come to that they're exposed to in the house. I think we should be very, very careful about the kind of cleaner we use for the floor. We should be very careful about scented candles. I'm not a big fan of scented candles, so I'm quite happy to say this. But dogs,
it's interesting, is it? If you don't like your scented candles, imagine what your Iggy Whippets think with their superior olfaction. Those scented candles are creating havoc in their brain.
Absolutely. You know, we've got noses, and we're very, very acute and astute. But dogs, I don't know what the figure is, 400 times more.
Oh no, more.
Half of their head is nose, especially for a wig. Whippet Italian Greyhound, you know, and so it at the worst it's going to be slightly uncomfortable for them, and at best it's slightly uncomfortable, and at worst it's going to be actually causing irritation and damage and possibly even inflammation. So I think, yeah, really, really be careful. And the other thing is, there are things like Febreze these days that you can just spray on everything. And I've had dogs who've had years of discomfort and what have you, and then we eventually they came to me and we looked and said, oh, dog gets really itchy when they lie on the leather sofa. What happens on the leather sofa? Oh yes, my boyfriend loves to use Febreze around the house. And so we said, right, ban the Febreze. Dog got better. It was really as simple as that. So all these things are sold to us as being innocuous, and I think very often they're not. We were, as dogs and humans, we were designed to cope with the cold, with the wind, with the snow, with the sun, with the lack of food, with lots of exercise. We were designed to cope with fresh air and what have you. We were not designed to be cooped up in boxes, bombarded with dust and chemicals each and every minute of the day. So I think it's worth just bearing that in mind. I'm not saying hoover your house 5 times a day, because life is obviously too short for such things. But what I am saying is, get out as much as possible, try and minimize the chemicals that you use. We actually use at the house here because we've got a septic tank. I won't tell you the whole story of the septic tank, but we've got a septic tank, and therefore we have to be very careful. And we got to the stage where we thought we have to put some probiotics down the drains in order to keep the septic tank going. And so I found a lovely company called Ingenious Probiotics, and they really are very ingenious. And this is what we use as floor cleaners and loo cleaners and soap, detergent, for doing the dishes and what have you. And therefore the house environment is cleaner and less full of pharmaceuticals, and also the septic tank is working much better these days. It is. It's great.
That's so mad. I love that. No, I'm on your page with it all. I mean, I've cut cleaners and I've never used air fresheners. I don't like them, and I don't like scented candles anyway, so that's all fine. I've always been using a plant-based cleaner, but what I have tried is Mr. Binks. The reason we went to the vets today, he has got a manky tooth, and so we went to obviously do bloods before surgery and have an inspection and all of that. So I've, funnily enough, been using probiotics, but for the mouth.
Is that from Joe Flanagan at Ingenious? Yeah. They do sprays. They do sprays for ears, probiotic sprays for ears. Literally, you spray into the ear, or they do, as you've discovered, the one for the mouth, which is really lovely. I used that because Bluebell was getting a slight brown stain on her incisors. She's 4 years old, and I used that kind of twice a week for 2 weeks, and bing, it disappeared. Really? So that was really, really reassuring. Yeah. And Joe also does one for allergy dogs, itchy dogs, and where you reassert the microbiome, the bacterial microbiome in the skin using this spray, which I think is genius, absolutely brilliant. We do it for our gut. Why shouldn't we do it for our skin?
It's just like you were saying, though, isn't it? It's about your home, because, I learned that your indoor environment can be up to 100 times more toxic than being outside. I mean, living in London, we're always being, told about the air pollution, and there's more car restrictions because of pollution. And of course, lead, carbon dioxide, nitrogen dioxide, is out there because of cars for us in London more than, in the countryside, but 100 times more in your house. That's ridiculous. So this is where, again, though, you see, by keeping your house clean using positive bacteria to negate any negative bacteria and create this balance, it works, though, doesn't it, Nick, in the mouth? I mean, I'm going to use this dental spray because I'm thinking, why not? Well, why not? If I put it in my dog's mouth, I'm going to it's fine to put in my mouth. If it isn't, then and it is, I'm sure.
Well, I would say, Anna, the thing to do, talk to Joe Flanagan, and just see, because your oral microbiome, as they call it, may be different, because we are omnivores and our dogs are carnivores, and therefore there will be there may be the same bugs, but it'll be a different spectrum. Potentially they'll have
interesting. Nick, thank you. No, that is interesting, but it is the same principle, isn't it? So you're keeping your dog's teeth and the home of their teeth in a bacterially balanced environment, just like you're keeping your own living space in a bacterial.
Very, 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 very much so. This is why I don't like, I haven't used kind of regular fluoride, soapy, fluffy toothpaste for years and years and years, because fluoride is an industrial pollutant, and I don't want to put it in my mouth. I don't let my children do it whenever possible. They love Colgate, but I try and dissuade them from using it. But also they use detergents to make it go all fluffy in your mouth, and you only realize it. You take that as being normal until you use. I use an Uncle Tom. I'm not being paid by Uncle Tom's, but Uncle Tom's fennel toothpaste, which is brilliant. It works really well. It doesn't go fluff and become soapy in your mouth, and because it doesn't contain the fluoride, it doesn't have that negative effect on the bacteria in the mouth, but also the soap will disrupt. You know, you've got biofilms galore within your mouth and your gut and your throat and what have you. And these detergents, which we were never, you know, humans were never meant to have detergent in their mouth for, you know, twice a day. Those are not disrupting the oral microbiome as well, and so I think that that's a really healthy thing. So I think be careful about what toothpastes you use for your dog, and ideally you don't need to use any toothpaste at all, because a raw-fed dog with having lots of bones and really good tough meaty chews and things like that, they will look after their own teeth. I've seen 15-year-olds with teeth that would be good enough for a 2-year-old, apart from a bit of wear and tear. And that's the way I think we should maintain our dog's teeth. It's, you know, it's dental week coming up soon, I think. And
Yes.
unfortunately, you know, we're told to use product X, Y, and Z and have a dental on a regular basis and what have you. But if you feed raw food and you feed bones responsibly, I've done a video actually, Anna, on my website. You
I
go to the
saw.
website.
Yeah.
It's called Bones and How to Feed Them. And the key is to get onto a raw food diet, and then there's some guidance there as to how you feed bones safely and constructively, and you might find that useful.
No, it was really good. No, I mean, Mr. Binks, I mean, Prudence, my bull terrier, her teeth are amazing. I mean, they've both been raw fed since
Brilliant.
the get-go, but Binks has got leg calf spurs. So he's a bit different. You know, he's missing a hip, and his teeth have not been good. I interestingly, I rehomed him age 2, Nick, and oh dear, he'd had every single vaccine apart from rabies by the age of 2, everything, the 2 boosters, oh, the works, kennel cough, you name it. And he'd had by 2 dentals already. So, and he'd had his hip surgery, you know, so a lot of work. His immune system obviously is compromised from the PERS. And of course, this blast very early on of a lot of stuff. So unfortunately, it's one of those things. So I've had him now 9 years, nearly 11, haven't you, Willie? And he's only had 1 dental in that time with me. Barbara Jones, who I know you know really well at Oakwood, has done, you know, I mean, when she does a dental, she's putting in arnica and hypericum at the same time as doing surgery, you know, Nick. Well, you'll understand doing that. Sure. Those are 2 major pain relief and anti-inflammatory homeopathic delicious remedies. But I tell you what, I'm adding with Mr. Binks. I'd love to know your feeling on this. Sure. So with bones and everything, bones, of course, full of calcium and it's bioavailable to dogs. But I take a lot of collagen, actually, because I'm at that age, unfortunately, where I'm wanting to hang on to my youth. And I've been giving Mr. Binks a collagen. So it's collagen for dogs, which I thought, due to his compromised state of having the leg PERS and all the rest of it, might help his teeth, you know, because of course collagen is a structural protein, isn't it, Nick?
It is. I think that adding collagen to the diet, the most benefit is going to be, the worse your diet is in the first place, the more benefit, because collagen, obviously, it's essentially it's connective tissue. It's what keeps your muscles all working together and moving in the same direction. It's what allows your bones to attach to muscles in order for your skeleton to move. Yeah, so it's collagen. It's integral to the integrity of the whole body, from your hair to your skin to your organs to your musculoskeletal system. And I think that the worse your diet, the more impact the collagen is going to have. So if your guys they're eating a really pretty good diet and they're eating bony material, which has a lot of collagen with it, because that's, you know, collagen attaches to bone, I think you might see more effect with you, because you're not eating bone marrow and chewing the skin off bones on a regular basis, I imagine, Anna. So having this collagen to stick in your coffee or in your juice in the morning or what have you. I think the impact is going to be big there because we are not half as carnivorous as we should be, and we don't eat enough liver and kidney and brain and heart and what have you, because we're all a bit squeamish in the West. But with dogs, I think they're going to be a lot further down that line, and therefore, for me, a well-fed, raw-fed dog is not going to have as much benefit as a kibble-fed dog, for whom the collagen could be absolutely transformatory. I think it really can. Do you see what I mean? It
I
depends.
do.
The
Yeah, no,
impact of any intervention depends on where you're starting from.
exactly. No, I agree. And yeah, it's weird. It never ceases to amaze me that I think the figure is still 80% of all dogs are eating a very highly refined, processed food.
Yeah, it is. It is about 80%. It's the last figure I saw was Alex German did a paper in 2018. It was in the Vet Record, and he said that 74% of dogs in a large thousands and thousands of dogs survey were either overweight or obese. And that was in 2018. We're 5 years down the line, and we've had the pandemic, and everyone was indoors and what have you. So I reckon that figure now in the UK is more like 80%.
Yeah.
8 out of 10 dogs are obese, and you know what? 8 out of 10 dogs eat kibble. I think there is a correlation. Correlation doesn't mean causation, but there is this very strong correlation there, because if you ate chips coated in chips, as in UK fatty greasy chips coated in sugar every day, which is essentially a high carb starchy diet, if you added that to your diet every day, you wouldn't be surprised if you became a lot fatter. And that's essentially what we're doing with the kibble. We're feeding this pretty poor quality meat meal combined with cheap grain or maize or wheat or barley or oats or something like that, or sweet potato, and then wondering why that has a massively obesogenic effect on our dogs, to the tune of 88 out of 10 dogs are overweight or obese.
It's shocking, isn't it? And of course, something a vet said to me years ago, when I explained I'd switched, Molly was eating raw. Back then, we're talking 2002. It was very difficult at times, Nick. Very, very difficult. You know, one vet said to me, "Well, why are you feeding her on raw green tripe? Do you know what it is?" He said to me. It's like, yeah, look, I might be blonde, but I do actually know what it is. Anyway, so
I'm with you. And
yeah,
but
I was going to say no. Can I just say this, because it relates to teeth? They would say, yeah, but look, your dog's teeth are just going to go really, really awful. Kibble cleans a dog's teeth.
Doesn't.
Of course not.
It doesn't. No.
Explain why.
Categorically doesn't. I mean, if kibble cleaned teeth, then why do some of the manufacturers produce a special kibble to clean teeth? So why would they produce a teeth cleaning kibble? And secondly, the average kibble dog will need a dental every 2, 3, 4 years. And the average raw dog, just for maintenance of a mouth, then they may go through a lifetime without need for dental surgery whatsoever. Obviously, if they crack a tooth or if they get a rotten tooth root or something, they're going to need specific intervention, just as you and I would. But just for maintenance, most dogs who go in for a dental, it's just to clean up the mouth, because the food and the chews are not cleaning the teeth as nature intended.
Exactly. And I always think, we're lucky we've got fingers, haven't we? And a tongue that can, move sideways. So, you eat a bit of Rivita or something, it will get stuck in your teeth. But we can just, carefully with a tongue, not to do it in a restaurant maybe, but we can get it out. But dogs can't do that, So it's extraordinary, But when, I love it when pet parents kind of go, "Oh, God, I get it." And there's this huge light bulb moment. And then that dog is going to go on the right path, isn't it, Nick?
I think it is. I mean, Anna, dogs have been eating meat. They split from felines about 45 million years ago. And therefore, they have been eating without any guidance whatsoever. They've been eating mainly meat-based diet, including hair and fur and eyes and brains and toes and testes and everything, and including some intestinal contents. That's what they've been eating for 45 million years. You know, we came along with kibble in about 1954, and the health of dogs has, and food is partly contributory to this whole thing, has declined since that time. You know, there's a lot more autoimmune disease, a lot more obesity, a lot more diabetes, a lot more hypothyroid disease. You know, other things to my mind, are contributory: the overuse of vaccinations, the overuse of pesticides, the overuse of anthelmintics when dogs don't need it. All of these things create a very toxic environment. And also, if you're feeding kibble, then you're going to get periodontal disease, which is going to drip bacterial toxins into your bloodstream, which in humans is correlated with low birth weight babies, with heart disease, with liver disease, kidney disease, autoimmune disease, and what have you. So I think, you know, keeping your dog's teeth clean with a fabulous diet that they absolutely love and leaves them with sweet, fresh breath every day of their entire lives, I can't see a downside to that.
I agree. And for me, you know, trying to slim a dog as well that's just fed kibble, I don't think you can do it, because fat cells create fat cells, don't they, Nick? They secrete enzymes that invade other cells, and then those cells become fat. And also, of course, the vet said to me this morning, I gave him a treat and he said, oh, it's a little bit fatty, that treat. I mean, you know, it didn't matter. Binks only had the one, or, you know, but I said to him, fat's good for dogs. It's the carbs that isn't.
Yes, I agree. We now know that fats are absolutely essential for cell membrane, for energy, for a good source of omega-3, for an anti-inflammatory effect. You know, we are learning that fats, you know, ever since 40s, 50s, Ansel Keys came along and said fat is the enemy, and if you have too much fat, you'll get heart disease. From a human perspective, we all bought that until about year 2000, and since that time we've learned that fats are absolutely essential, and if you don't get the right fats, you're going to seriously compromise your health.
It's interesting. And of course, dogs, well, correct me if I'm wrong on this, Nick, can dogs get high cholesterol?
Cholesterol doesn't seem to be an issue per se, as it does with dogs. You know, if you know, and the whole cholesterol, that argument is slowly slipping away, methinks, because, Anna, what happens is, you know, people used to get very upset about eating too many eggs a week, but actually your liver makes more cholesterol than the average person can eat in a day, you know, even if they're eating 3 eggs a day or something. So this whole idea that, oh, cholesterol is the enemy, cholesterol is used by the body to kind of patch up damaged tissue. So if your body is running and there's a lot of inflammation and your blood vessels are being damaged and what have you, there's going to be a lot of cholesterol floating about and trying to patch up the blood vessels. The problem isn't the cholesterol. The problem is the fact that you've got this high level of inflammation within your entire body, and that's what causes the cholesterol to be there in the first place. But then you've got low density lipoproteins, you've got very low density lipoproteins. So the whole cholesterol is quite confused. But suffice it to say, is cholesterol is essential. It's made, loads of it is made by the body every day, and I don't think that eating some cholesterol every day makes an awful lot of difference. I think what we need to do is eat real food and allow that to help us to be as healthy as possible. Michael Pollan said, eat food, mainly vegetables, not too much. And I think that's a pretty good approach. As a human, the doggy equivalent would be, let me see, I haven't thought about this, but it would be eat food, mainly animal product, not too much. There you go. That's me paraphrasing the wonderful Michael Pollan, American food and other things writer.
Love that. And that is such a lovely way to end, with a great deal of food for thought, Nick.
Food for thought, indeed. Well done.
Thank you.
It's great to talk to you, Anna. Take care. Thank you.
Hope to see you soon.
Bye-bye.
That's our show, Mr. Binks. What did you think? Yes, I know what Nick was saying about probiotics and keeping the bacteria in your mouth all balanced with good bacteria makes a lot of sense. What's that? Yes, you're right. It is time for Woof of the Week. It's interesting that a lot of people have trouble brushing their dog's teeth. But maybe if you think about the right diet and adding probiotics to balance the bad bacteria, we can all keep our dog's teeth in good nick. Well, I hope you all enjoyed it. If you did, go on, rate and review the show wherever you tune into your podcasts. Thanks again, of course, to Dr. Nick, and all the links are in the show notes. Thanks, of course, to Mike Hansen, my producer, for all the music and production as ever. Find out more about him at Pod People UK. And for me, I'm just at Anna Webb Dogs. What's that? You're right, Mr. Binks, we will be in your feed next Sunday. But if you subscribe now, then you'll never miss another show. Bye for now.